Good afternoon. Good to be back.
Good afternoon, Bill.
Is that Bill Bowles that just spoke?
It is I.
Hi, this is Ann in Green Mountain Falls. So good to hear your voice. Cool.
It's Skinny Ed. You really look good. You know that. I can't hear you. You're muted. Unmute.
Give a reminder to use the microphone. You want me to do the housekeeping reminder?
Okay.
Good afternoon, everyone. Let's call the CAC meeting to order. And we do have a couple housekeeping things.
Just a friendly reminder, if you are out on Zoom, make sure you mute yourself unless you're actively speaking to the group. And then if you are here in the room, make sure to turn your microphone on so that way those on Zoom can hear you. And when making a motion, if you'll state your name for us, we can capture it in the minutes. That would be great. Thank you.
Anything else? And we have a quorum has been established, I presume.
Yes.
Okay. Do we have any special introductions? Don't think so. So we have 3 consent items, the agenda, the minutes, and the board financial reports. So we can act on them as a whole. Do I have a motion to?
We do have an amendment.
Oh,
request
we have
for
an
the
amendment.
agenda.
Okay, oh, that's right. Go ahead.
So we do need to request to remove action item 5C, the tip amendment from this month's agenda, and to move that to next month. So with our consent motion, we will ask someone to move to approve the consent items with that change to the agenda is the motion we're looking for.
Thank you. So do I have a motion, please?
Sharon Brown, I move that we approve the consent agenda with the change.
Do I have a second?
Second by Gary Sugar.
Thank you, Gary. All those in favor?
Aye.
Aye.
Any opposed? Motion carries. Wonderful. Next up on the agenda is public comments. Do we have any public comments that were submitted?
There were none received by email.
None received by email. Anybody else? Okay. Well, that's good. We can move on to item 4, information items. 4A, Jessica McMullen, Policy and Communications Manager. Let's get the legislative update.
Good afternoon, everyone. Jessica McMullen, your Policy and Communications Manager. So the legislative session began the second Wednesday in January. It's going to run until the second Wednesday in May. During the legislative session, the PPACG's Legislative Committee meets weekly or as needed to review bills relating to the 2022 legislative themes or the 2022 initiatives that were established and approved by our Board of Directors. Those themes are protect and enhance services for seniors, protect and enhance transportation, support air and water quality, support and protect military partners, and regional quality of life. And the 3 legislative initiatives that we're working on this year are senior affordable housing, wildfire mitigation funding, and funding support for GHG rule implementation. The Legislative Committee did their first round of bill review. As of Monday, there were 242 bills that had been introduced, only one of which had been read on the House floor yet. Of those bills, our new lobbyist, Dan Jablan from Cherry Point Strategies, and I reviewed those bills and pulled out several of them for the board's review. They selected 10 bills to review. Those bills, you can always find those on our website under the Legislative Committee agenda. But those, along with their proposed positions, will also be available in the board packet when that's released. Or you can always email me to tell you which ones we've specifically looked at and what those proposed positions are. How our process for legislative positions works is the lobbyist and I pull out bills and bring them to the Legislative Committee. And these are ones that relate to our issues. The Legislative Committee reviews them and says, is this a PPACG issue? Yes or no? If it is, should we support, monitor, or oppose? Or should we actively support or actively oppose? Those positions, as suggested by the Legislative Committee, are then emailed out to the Board of Directors. And we say, does anybody have any problems with this? You got to let us know, because we have to move fairly quickly on those positions so we can give them to our legislators so they know PPACG's position. They get 24 hours to get back to me and say yes or no. And if anybody has any concerns, we tell our lobbyist, don't present this as our position until we've had the chance to talk to our legislators about it. To talk to our entire board and really review this. So they've done their first review. We will continue to meet. We meet every Monday morning at 8:30 a.m. via Zoom. So if anybody is ever interested in listening in on one of those meetings, let me know. And otherwise, one of the things that we do hope everybody remembers, if you hear about legislation you think PPACG should know about, or you just want me to know about, send it to me, email me. We're more than happy to do some research, help you dig in on that. That is one of the skills that we hear. And we really do want to be helping all of our CAC members be connected and know what's going on with PPACG amongst others. We did include a copy of our legislative trifold in your packet. That document is one that we give out to all of our legislators so that they've got a handy dandy thing that they can touch that says, this is what PPACG cares about. And then at any given time, you can go to the legislative tracking site link that's in our packet as well. And that will let you know what bills we're looking at and what our current positions are. So those are two items that I think are helpful. Does anyone have any questions about the legislative session, what's going on, or anything relating to that?
Jessica, this is Ann in Green Mountain Falls.
How can I help you?
Excuse me. First, I want to compliment you. I think this is great. I clicked on the what is it called? Colorado Capital Watch.
Mhm.
All the bills. That is really great. I looked at those. Now you said the legislative trifold. I haven't scrolled down enough. Maybe is it what's above?
So
Oh.
yeah, it's in our board packet.
Oh,
right
I
there.
see. Yes, I couldn't think what you were talking about. Okay,
Yes.
thank you. But that's really, really, really good. Thank you.
Oh, thank you.
Mhm.
Anything else for Jessica? All right, next up is PPACG Area Agency on Aging overview with Jody Barker.
Good afternoon, everyone. My name is Jody Barker, and I am your Area Agency on Aging Director. And Jessica had a fantastic idea that the Area Agency on Aging would come to you on occasional basis and provide some updates so that you know what's going on with our department. And so we thought we'd start off with just a big overview of what the Area Agency on Aging is and does and how we were founded and things like that. And then moving forward, Jessica will be inviting different departments to come in and share very specific information regarding the additional program. So I'll talk about them in general today. Happy to answer any questions I can off the cuff. And if there are specific questions that may be related to other departments, we will certainly get that information back to this board as well. So the Pikes Peak Area Agency on Aging is, as you know, structurally one of the departments of the Pikes Peak Area Council of Governments. And the area agencies on aging receive federal and state funding. Federal funding through the Older Americans Act, which was initiated in 1965, and the Older Coloradans Act, which was initiated in the mid-1970s. And those are our two primary funding sources for the services that we provide in the community. And so right now, on average, we receive about $5.4 million in funding between those two funds. We provide services to the community directly right here from our offices and our staff. And then the majority of the services offered throughout the community and with that funding, though, actually is through contracts and partnership with others across the 3-county region. Excuse me. And so because of the types of services and specialties, it behooves us to find good partners, as you might imagine, to make sure that since they are the experts in what they do, find a way to partner with them to serve the seniors of our community. Just like the PPACG, we serve the same primary 3-county region, El Paso, Teller, and Park counties. Through one of our other programs, though, case management and the SHIP counseling. The SHIP stands for State Health Insurance Program. The SHIP counselors actually serve a 9-county region out of this office. I'm not going to give you that list off the top of my head because I will mess that up. But just so you know, we are serving folks all across Southern Colorado for those services. So that service is actually funded in part by our standing funds from the state and federal level accounts, but then we also receive some additional funding from the Colorado Division of Insurance to expand our education through those additional 6 counties. So our strategic plan really focuses on advocacy, information sharing, aging, of course, which is our department, transportation, and program excellence. The interesting thing is that there's so many crossovers in all of that, which really allows the Area Agency on Aging staff to be part of conversations so that we make sure that aging is always brought to the top, brought to the forefront in the conversations. Now, we know that our aging cohort just continues to do that. We continue to age. And so we have to look at not just the individuals that we are serving today, but you and I that we are going to serve ultimately in the future, right? And so it's a wonderful opportunity that we have in the way that we can serve our older adults. Our number one criteria in serving our aging community, we're very fortunate that the primary criteria is that a person is 60 or over. There are no limitations on income or what kind of house you live in or what kind of car you drive or what part of town you live in. If you are over 60 years of age, that is the primary determinant for services that we can provide you or provide the community. And so it allows us to work with not just our internal departments, but with providers across the city and the 3-county region to ensure that services are provided well. I thought I'd highlight some of the services that we do directly from within our staff and right here from the office. We have our Senior Information and Assistance Program, and you are probably very familiar with the yellow book that's out on the steps. We got some newspaper boxes during COVID to make sure that we would have those available 24/7. We also distribute the yellow books all throughout the city directly from the printers. But we are still able to provide those now, not just in print, but online. And so people can go to this as an information resource at any time 24/7. And if you can't find it in here, you call our information and assistance hotline and someone will help you narrow down really what it is the individual may be looking for. So you just never know some of the questions that we might get through our hotline, but we have great staff members as well as a contingent of volunteers who answer that to make sure that that folks can get the resources that they need. We also have our Family Caregiver Support Center, and that is exactly what it sounds like. If an individual is providing care for a family member, that family member may be older or younger than 60 years old. As long as one or more of the individuals in that partnership are over 60 years of age, they may receive services from us at no cost. And I do want to make clear that most of the services that are offered whether internally or out through our providers, may be offered at no cost to the individual. It varies, but that's the rule of thumb. So our Family Caregiver Support Center provides support groups, family counseling sessions. We also host, and this will be our 19th annual Caregiver Pampering Day. And that is an opportunity for caregivers to get pampered, just what it sounds like. And so we have special speakers and activities and things like that. We've had to get a little creative during this time of COVID, as you might imagine, but the team and the volunteers who put that on have just done a spectacular job in making sure that those family caregivers know that they are loved, know that they are doing the best that they can, and receive additional help. But in that day, it's a time for them to get pampered. So traditionally, pre-COVID, that included special cooking classes. It might include exercise classes, massage therapy, and things like that, just to give someone a respite from their caregiving. Now, the second question that comes to that, well, where is the individual who would normally be receiving care, right? So the caregiver leaves home, who's going to, we have a wonderful group of volunteers from the community, but also volunteers from home care agencies who provide support, provide caregivers at no cost to the caregiver on that day for that purpose and for that special event. So the caregivers are truly pampered because they don't have to worry about the cost of them leaving the house for 5 hours. And they get to focus on themselves, which is truly important. We also offer medical alert systems through the Lifeline systems. That's the traditional button on the necklace. We have our senior insurance assistance, which we talked about a little bit earlier. Our long-term care ombudsman program is that of advocates for long-term care residents. And so when we think about long-term care, we're thinking about assisted living and skilled nursing care residents. And this gives them an opportunity to connect with someone who is an advocate for them, who's going to focus on their needs and allows them to say, I'm concerned about this, I don't like this, the food's cold, it doesn't matter. The ombudsmen are there to serve purely as advocates for those residents. We also provide vouchers through our homemaker and personal care services. And so just like I described with the Family Caregiver Support Center, who also offers respite vouchers to caregivers, this is an opportunity for someone to receive a few hours of homemaker or personal care in their home at no cost to them. It works on a rotating schedule based on availability of funds, availability of caregivers, but this is another opportunity where we contract throughout the community with providers to enable those services. We also have currently this year 17 providers that we're contracting with for additional services like congregate meal programs, home delivered meals, transportation, case management. I'm not going to read through the whole list. This is in your packet, so you can see, and Jess has that up on the screen there. But legal assistance and personal care, nutrition counseling, caregiver counseling, mental health screening, dentures and dental services, low vision or blind services and training. There are just so many opportunities we have through this funding to serve the community for folks who may not have access to these services otherwise. So a few things that we do to continue reaching out to our population and our community is we host what's called the Aging with Altitude podcast, and we have special speakers talk about issues around aging. We also launched Age-Friendly Portal in partnership with the Innovations in Aging, and that's a separate website from our PPACG.org website. It allows people to look specifically for services around aging. This year we expanded the INT retirement series. Traditionally, that's been 5 sessions in a calendar year. This year, INT supported us in doubling that and going statewide. So instead of just the 3-county region, folks from around the state were invited to join us in that retirement series. And then we also have our Medicare classes in partnership with the library district, as well as biweekly lunch and learns. So huge overview. I know this is a 30,000 foot view of who the Area Agency on Aging is, but I always love to take this opportunity to just brag on our staff. We have folks who have been here for 26, 27 years. We have folks who have been in the aging field for a big part of that, even if they've only been with us for a short time. I've been on staff now for, what are we going on, 2.5 years. But I have been in the senior field here in Colorado Springs now, going on 24 years. And so this is kind of my graduation party, as it were. Really proud to lead this fantastic team and work within the PPACG structure. So with that, I just ask if you have any questions now. I am very open to that. And as you mull through this information, just know that you're going to be getting some more presentations from my staff. So thank you very much for this opportunity.
Thank you very much. Do we have some questions from those out on Zoom?
Can you hear me? This is Ed.
Yes, we hear you,
Uh,
Ed.
Okay, having problems with my Wi-Fi connection today. I apologize. Question I have, I represent Rama, which is about as far out east as you can get. Transportation for some of our seniors is limited. Is this something they can do mostly on the phone, online, or do they need to physically come into your location?
Thanks so much for that question, Ed. Yes, I know where Rama is, and we actually had the opportunity to serve Rama and Calhan here just recently with some FEMA food boxes through the Calhan pantry there. So I know exactly where you are. You're that wide spot in the road. So, but I will say the beauty of our programs is that you can truly reach us either by phone, online, or by coming in to the office. The in the office portion right now, I will share, is a little more challenging because of COVID. If you are about to turn around and share this with your town council or a social group, church group, that kind of thing, I would ask that you, I would recommend that you give the office a call and set an appointment. And that'll make it much easier to ensure that we have the right people here, because we do not have a full contingent of staff in the office every single day. But ultimately, you know, pre-COVID and when things start to calm down, we'll look a little more normal.
Okay, I actually think on phone or online will be easier for them, but I just wanted to verify that's what you were getting to.
Certainly, the age-friendly portal that I shared is very interactive, and so folks can pick and choose the icons and the information that they might be looking for. There's also a contact button to where they can just plug in their question, and we have staff and volunteers who watch that and follow up with that.
Okay, thank you very much.
Yes, sir. Thank you.
Can you repeat the address URL for that portal, please?
Yes, that is age-friendly. Can you pull that? No, Jess, can you pull that up? It's the age-friendly. We can get that put up and put in the chat for folks. It's not going to be in your slide deck. It's the age-friendly.
Agefriendly.org. Age-friendly pikespeak.org.
Yes, thank you. And we'll put that in the chat for those of you on Zoom. Awesome, thank you. And you
Thank
can
you for-
access that if you happen to be on the ppacg.org website as well. They are interactive back and forth with links. So there's the front page there. So it's this was actually done in partnership with the Innovations in Aging. You may be familiar with the age-friendly projects that are going on, primarily in Colorado Springs, but now across El Paso County. And this was a project that was started before I came on staff, and we got it wrapped up and launched shortly after I came on staff. And it's a very user-friendly system to access information.
Yeah, I think that's wonderful, and it'll be an easy way for people to contact you in the COVID environment. Any other questions?
Yes, Mr. Barker, thank you for taking time out to educate us on this program. I wondered if you have any services or education for helping people avoid scams. I know scammers are getting very clever, and it's hard for the everyday average person to combat that. And I think that seniors are particularly targeted by scammers sometimes. And so I wonder what kind of protections or education or services you might offer with that.
Yeah, thank you. If someone were to call us concerned about a scam, we can help walk them through whether it is or not, or who they should contact. If someone has been scammed, we recommend the Attorney General has a special hotline set up. I'm going to ask you to double check it for me. 1-800-222-4444, I believe. And that is specifically around reporting scams and getting assistance on that.
Good question. Any other questions? Well, I have one last one.
Certainly.
I wanted to get a sense for how many people you are helping. Because I have a feeling there's lots of people out there that need help that don't know about you.
You know what? That is probably the $1 million question right there. And I do appreciate it. Across the 3-county region, we know that there are people that have no idea what an area agency on aging is. And it's not just our region. That's a conversation we hold at the state level within our network, and even at the nationwide level. There's so many opportunities that folks can access us for information, and people like to call us the best kept secret, and that just makes me want to pull the rest of my hair out because I don't want to be the best kept secret. I don't have specific numbers. I wish I did to give you because of the so many contracts that we have out. So like I mentioned earlier, we have 17 specific contractors right now. We have 18 home care providers. We also have additional contracts and MOUs with additional folks, agencies across our region to provide services. I will say though that we know our numbers are low. We know that people aren't reaching out to us, and that is an ongoing conversation about how best to reach folks. And sometimes that's not necessarily from our office. It's making sure that those providers who are providing services have additional resources as they become available to ensure that they can reach more people. It's an ongoing, I hate to call it battle because that sounds ugly, but it is an ongoing reality for us as aging service providers, is making sure that people know that they have access to essentially a service at no cost to them, because there are so many, whether it's a scam, whether it's a service that comes with a fee that may not necessarily be necessary. We can provide those services at no cost.
Thank you. Thank you. Any other questions? I keep thinking of questions. Sorry.
Keep going.
One
I'm
last
not-
question, I
My
promise.
office is about 20 feet that way, so I can come back if you need me
Um,
to.
so the 211 service, they know about you. And so you get referrals from them?
We do, as a matter of fact. So if someone were to call 211, 9 times out of 10, they will be simply referred right back to our primary number, 719-471-2096. As soon as 211 knows that they're talking to someone over 60 or they're looking for services for someone over 60, that again is another one of our partnerships. It's a less formal partnership, but we make sure that we engage, especially during COVID time. We were engaging around vaccine efforts and education efforts, but we make sure that we plug into all those appropriate places. But yes, as soon as they know they're talking to someone or needing services over 60, we get that call. We sure do.
Great. Great.
Yes, ma'am.
Thank you. Well, we on the CAP can help spread the word. So,
Excellent. That's what we
yes.
want to hear. That's what we want to hear.
So-
We do have yellow books still on the here, plenty of current printed yellow books, both out in the newspaper boxes, here in the office as well. It is available online. But I do want to reassure people who are looking at the 2020 that we are going to print a smaller portion, but we will be printing a fresh book this spring. So more to come.
All right. Thank you,
right.
Jody.
Thank you.
Okay, last chance for Jody. No more questions for him?
Just one quick one. We need to remember that a lot of us out here in the country do not have an internet connection that we can depend on. So it's whatever we can find.
Right. And I know I recognize that voice. That's Bill in Lake George area. So thank you for bringing that up, Bill. I would say too that Bill is a fantastic advocate. He sits on our regional advisory council. And I know in the past, if I have materials to share in the rural areas, he says, take it to the fire station, I'll get them out. And so that's what I do. I take them right up to the Lake George Fire Station and he spreads those out in the community. So we have a good working relationship, not just with our advisory councils, but with so many entities across the 3-county region. When the FEMA boxes became available, it literally fell in our laps. It was a partnership at the state level with FEMA, and they contacted us and said, how can, we can get these to you, but you'll be responsible to share these out to the county. Each box was a 30-day allotment of food for a single individual, and so 90 meals per box. And we just started reaching out, not just to our contractors, but others that we have relationships with across the 3-county region, and we made it happen. We called up county commissioners and said, can you send a truck? Can you send a trailer? We're going to have food. And everyone just really pitched in, was fantastic in helping us spread those. We had those, like I said, out to Calhan and Rama. We had it out to Fairplay and Bailey. We had it out to Rush and down to Fountain Security Widefield area. I mean, we just spread the love. And so it was so exciting to be able to put together a project like that and just call on folks to help us with that. So yeah, that's what we're here, is to help our community.
Well, thank you very much. Appreciate it.
Thank you.
Next up, Multimodal Options Fund, the MMOF updates. Michael Snow.
Yes, hi. Give me just a moment. I'm gonna share some slides with everybody. I've got to kick those off. Many clicks of many buttons here. Okay, all right. So hi, everyone. Michael Snow, I'm with CDOT's Division of Transportation Development in the planning branch. And I'm also the program manager for a program called the Multimodal Options. And you've likely heard of this program in the past. It's got a short life cycle. It's created by our legislature in 2019. And back then they made a one-time allotment of funds to the program. And so a good portion of those were awarded by PPACG to area projects. Good news is that our legislature revisited the program and with Senate Bill 260 made a couple changes to the program. And the good part is that they have identified and are providing sustainable funding to the program for the first time. So with those changes and the new funding, some new program requirements and funding formulas and such have been implemented. So I'm here to tell you about those, and I'll go through this and try to tell you as much as I think is useful. Stop me if you have questions, and I'll move ahead. And one of the fundamental changes you'll note in the latter two bullets here is that the name of the program was changed. It was previously called Multimodal Options Fund, and it's now called the Multimodal Transportation and Mitigation Options Fund. Same acronym we use throughout CDAT and elsewhere. We use the MMOF acronym. All right, so in nice bright blue bold letters here is some of the fundamental changes from this is from statute on the defining what the purpose of the program is. Not a lot of really huge changes fundamentally. It is a program still intended to provide multimodal options, that is alternative types of transportation modes and access to them, and in particular to provide those to in a way that benefits seniors, making aging in place more feasible, intended to provide those options to rural areas, and change that to also recognize the need to address where we typically have underserved parts of our community, and those are referred to disproportionately impacted communities. Also intended to provide mobility for people with disabilities, to address safe walking and biking routes to school for children, and then the latter change, which is projects that reduce emissions of greenhouse gases resulting from transportation. So with those fundamental changes comes some slightly different types of projects that are eligible under the program. All those that were previously eligible are still, and you'll see them here. The most notable one is transit, all fixed route or on-demand transit services, both capital or operating expenses. Transportation demand management programs, mobility projects enabled by new technology, which I think I heard a little bit of conversation about some of those today. Multimodal studies, and a couple new types, which is modeling tools, which may obviously support the type of thing that we're seeing in the greenhouse gas mitigation and greenhouse gas reduction. So you have to do considerable modeling to forecast what those investments mean to greenhouse gases, and then bike and pedestrian projects. Any questions?
Yes, sir. Michael Colombe. And
Hi.
in the previous slide, the previous slide, it said it benefit rural. It's not in blue. It said benefit residents of rural and for flexible public transportation services. I live in a rural area, and how could you name what the benefits would be to those in the rural area?
Yes, for multimodal investments. Well,
yes.
Yeah. So any investments, the type of projects we talk about, right? Bicycle and pedestrian. Let's say some examples might be to build sidewalks through small rural towns where they don't have safe means to walk along the roadways, or it could be to supplement the amount of demand response transit services that are offered to regions of this rural regions of the state. Some of your mobility, technology type of things with, I believe the previous speaker was likely talking about some of the services they do to try to reach and make it more readily available, the transit services to elderly, how you reach them and communicate with them and that sort of thing. So some of those types of investments are eligible as well, and can benefit rural areas.
Terrific. Yes.
Yeah.
Okay, super.
Yep.
Thank you so much.
Yeah, of course. And of course, the program is eligible for projects statewide. It's just that typically the alternative type of transportation infrastructure and services have not had as much investment in rural parts of the state. So the legislature specifically called it out in hopes or suggestion that the state and local entities look at how well rural folks are served by alternative modes, since you're definitely more dependent on vehicle access and being able to get places. So a little bit of soapbox
Super.
there.
Thank you so much.
Yeah. All right. So let's get on to the good
Yes.
stuff. This is the what you really want to see. In the Senate Bill 260, it generated it's created some new sources of revenue. It's dedicated some existing surplus state revenues. It's also dedicated some of the federal ARPA stimulus dollars that came to the state of Colorado, and they all add up and will be distributed throughout the state. The big table of numbers you see here show how Senate Bill 260's funds will likely roll out over the next 10 years. We really only know for certain the first two lines. And after that, it's really just projections because they're new revenue sources that we don't know the pace that those funds will truly be generated or not. And so then in the multimodal program, the statutes break out those funds to two different pots, with 15% staying with CDOT for the Transportation Commission to award to state and regional multimodal projects. And the lion's share, 85%, gets distributed to the planning regions, including the Pikes Peak region. And this is where you all come into play with Pikes Peak as an organization and in your community. It's the specific pot of funds that will be accessible to local agencies for funding these types of projects. Pikes Peak can be seen for their current allocation. And again, the first two lines up there, the FY22 and 23 funds, are the federal stimulus funds and the state funds. And those are both essentially ready for programming or awarding to projects and are being distributed to the planning regions. So Pikes Peak region will be seeing just shy of about $19 million. All right, and noted up above those, it may cause some confusion. When we go back again, you'll see that the federal amount and the state amount are not equal. However, CDOT will use more federal dollars for its 15% portion, simply because federal funds have a little bit more limited uses and they just have more limitations than state dollars do. So to provide, to benefit the local regions such as Pikes Peak, CDOT will utilize all federal dollars, which means that the 19 million coming to Pikes Peak will be pretty close to 50-50 federal stimulus and state revenues. John, that's probably the first you've heard that news, but that's the result of the conversation we had with the statewide MPO.
Yeah, it is the first, but glad to hear it.
Yeah.
And Michael, just so you know, we've got folks from all over the Pikes Peak region.
Okay,
Just so they know, if you're in the Metropolitan Planning Organization or MPO area, that's TPR #1 of the Pikes Peak. And then if you're in sort of unincorporated El Paso County on the ends, you're part of the Central Front Range TPR. So our COG has two separate TPRs in them, and Central Front Range is sort of, you work through CDOT and the CDOT process, while the Pikes Peak for the MPO, you work through our process. I just wanted to make sure we mentioned that because I think, like I said, we've got folks from different parts of the.
yep. Yeah, thanks for that reminder. I completely forgot you have the unincorporated Eastern El Paso and all those other outlier member entities. Okay, let's keep going. Whoops.
Mr.
no,
Snow, sorry,
Yes.
this is Patty Benger. I have a couple of questions.
Yep.
My first question is, on the agenda summary, it mentioned an updated distribution formula. Can you talk about how those dollars are formulated to figure out which area gets what percentage of money?
Yes, of course. I was going to skip over that a bit, it gets a bit into the weeds, but I will talk through it a bit. The distribution formula is adopted by the commission. However, it was developed by an advisory group of members of our community, including representatives from the STAC, representatives from Transit and Rail Advisory Commission, representatives from our state agency on aging, some bike and pedestrian advocate groups, transit advocate groups. In other words, a lot of local and regional stakeholder experts who developed that formula. And the result is a formula that includes 11 criteria that spread out. There are a lot of population criteria, such as total population, elderly population, disabled populations, number households with zero vehicle access, some bike and pedestrian crash statistics, transit, including transit ridership type of measurements. What else? So, without getting into any more of the weeds of it, basically you can take all those criteria and provide a weighting to those, and it gives us our distribution across the state.
And then I guess my next question would be, so the Denver area is getting such a large portion of these dollars at 60%,
Yep.
While the Pikes Peak area, which includes more rural areas, includes a 9%, as well as some of the other eastern and other rural areas listed here. Why is the Denver area getting so much more money than the rest of the state?
Well, if you look at that formula and the statistics, it's because all those population counts all are concentrated to Denver. That's just the reality of just how much is concentrated in that Denver region.
Sharon Brown, I have a question. In the Denver area, does this take in Boulder as well?
Yes, it does. So
Okay.
when we say Denver area,
Right.
yeah, if you haven't seen the different, really understand the composition of, Dr. Cog and the MPO versus the TPR.
Right.
Yes, Denver area, when we talk about Denver area, we're truly talking about the entire TPR, which is all the way up there into, a little sliver of Weld County and Larimer County and Boulder County and yeah.
Okay.
Yep.
Made a lot more sense. That's good.
Mhm. All right. So I didn't apologies. I didn't expect the questions about the formula so much, and John has access to that, and he knows the formula as adopted. It's another table of numbers, but perhaps he can share that with you, and if you really want to examine it in more detail, that's available to you. All right, here we go. I'm going to keep going. My slides aren't responding. Okay, so while the distribution formula was updated with more current data and slight changes to those criteria, we also took opportunity to address the match reduction formula. So the MMOF program has a statutory requirement for a 50% match rate. That means that for every project funded, at least 50% of its funds must come from other sources. And that can be federal, state, or local sources. But the legislature also made it possible for the commission to adopt a formula that would reduce or even eliminate those match requirements based on some factors. And the same committee of stakeholders that developed the distribution formula have also proposed, and the commission has now adopted, a new match reduction formula that automatically grants a reduced match rate for cities and counties based on the criteria you see here. And that is median household income, median home value, the poverty rates, and the percent of elderly populations. That formula grants either a reduced match rate to 25% or an eliminated rate down all the way to 0, which means the multimodal funds could fund 100% of a project. Questions on that? All right. And some other things to consider. A little bit more complicated when we're talking about two different types of funding. As I mentioned, about half of the funds are going to be federal stimulus funds. The other half are state funds. One of the differences between those fund types is that the ARPA stimulus dollars have a shorter life cycle to them. They must be expended by the end of December in 2026. And, that they are intended to be stimulus dollars. So naturally, projects that are more ready to be implemented would likely need to be prioritized to those federal dollars so that they get spent as quickly as possible. There's no opportunity for CDOT to get an extension on those stimulus dollars. So if they don't get spent, as in if you have projects that somehow get delayed and they extend beyond 2026, guess what? They'll lose their funding, and the state will as well. So some complications to your project selections, obviously. And then the next thing I want to talk about is that it has to do with the intent of the multimodal program. And when it was created in 2019, I think a lot of the legislative proponents felt that this is going to provide the ability for regions of the state with inadequate level of transit services, that it would make it possible to supplement or put new services in place. The reality was that with just a single one-time pot of funds, you can't really fund a new transit service. Why? Because a typical transit service expansion means you have to make a capital purchase of some vehicles likely, and then you also have to be able to sustainably fund the operations of it long term. So now that this program has a big chunk of funds up front and will have subsequent funding in the following years, new types of projects can be considered, including ones that might be a new transit service, a new route, or additional days of the week, or an area that to get served that isn't prior served. All those can be considered, and the Council of Governments there can choose to fund them not just with a capital vehicle purchase, but also long-term operational funding. All right, I'll keep going. And then federal match funding limitations come with this. And on this slide, I talked about the dynamics of the match requirements. I have two project examples. In a multimodal project using state funds, you could combine funding, and some local entities have done so on past projects whereby they sought to fund half the project with multimodal funds and half with some of the federal programs like Transportation Alternative Program, in which case they could literally fund it half and half. They match one another. If the multimodal funds are federal stimulus dollars, that changes. Why? Because the federal stimulus dollars can no longer match another federal program's match requirement. So that similar situation could now be 50% funded with MMOF federal funds, but the locals would have to bring 100,000 of the local funds to properly match the TAP funding program. Okay, I'm gonna keep on going. Kind of getting to the end here. The allocations have been made, and there'll be some communications coming out from CDOT to the MPO there with allocations and guidance materials. We'll be getting that out very soon. And the MPO is likely preparing for a call for projects. I'm going to turn it to John to actually talk about when that's going to happen. Every region's doing it a little differently.
Yeah, thanks, Michael. And I'm not sure that we've set that process up yet. I think we're still sort of waiting for the application and guidance. But as soon as we've got our process set, we'll do that. A quick question for you, since you brought up one thing that, and I apologize, everybody's probably a little in the weeds for you guys. But is there an opportunity, as we were looking at the Main Street program, I think, it came out that a lot of our jurisdictions have TABOR limits, and they're much better off with all federal dollars because they can't take the state dollars, or if they do, they end up having to dump something else that they're doing. Yeah. So if when you're putting everything together as far as the guidance and everything, if you haven't done it already, we would sure appreciate an option where TABOR jurisdictions can request all federal funds. And that, of course, would then free up the easier state funds for those non-TABORed one. So it could be a win. But if you could have any flexibility in that, I do know our TABORed jurisdictions would sure appreciate it.
Interesting. Well, that is a new consideration. Again, late in the game, but it should be something we could address with simple, our simple accounting and funds management. So, yeah, good thought. I'm trying to think, how would we identify where the various jurisdictions have that limitation? Do you ever seen anything, John, where we might be able to kind of cobble that together so we understand the statewide?
Yeah, well, I think, for example, El Paso County, if they get a certain amount of state dollars and they've hit their TABOR cap, they then are limited, and then they have to dump someplace else from something else they're funding to take that. So maybe in the application, there could be a box that says TABOR limited jurisdiction requests all federal dollars. That would sure be helpful for them. And we can talk through it in more detail. In fact, and we can invite in El Paso County because they're more of an expert at it than I am, and see how that could work. But if you're to that, we'd sure like to have that conversation.
Yeah, no,
conversation Michael and I could have offline, not in front of everybody. So I apologize.
Yeah, no worries. I mean, I presume you will both, for the COG making its awards decision, you may prioritize the federal funds to those TABOR jurisdictions, but you're also saying statewide, might the Pikes Peak region get a greater share of federal funds in order to maximize that, I guess,
No, I was actually trying to keep it simpler, that just saying of our funds, are we allowed to give more of the federal dollars over. But I guess if I have more than just a few Tabor jurisdictions, then yeah, I guess I could look at trading statewide. Again, I think you and I are in the weeds. Let's
Yep.
take it offline. I don't think anybody on the really.
Yeah, no worries. But
Too much about this.
let's keep this in our pocket because this might be something that is kind of something that needs to be brought up at STAC as everybody is seeing their applications come in.
Right.
Right? Okay, good. That's it. Here's my stuff. Got any questions? Feel free to email me, call my phone number there. Happy to answer any other questions. Now's the time for everybody to get the word out. We need to make sure that especially small agencies that aren't as engaged with the public planning process on a regular basis need to be aware of these new opportunities. So, yeah.
Well, thank you very much. Any other
Mhm.
questions from CAC members?
Yeah, this is Donna Wood, and I wonder if there's the ability for you to think about doing like a bus stang between Colorado Springs and Denver for the professional games that go on, like the Rockies and the Broncos
Yes.
and that type
Yeah,
of
thank
thing.
you. I saw that in the chat and forgot to answer. So I did once work in the Division of Transit and Rail, but I don't now, and I'm not as familiar with the future route and services being considered. I can't say if that is one being considered right now. Yeah, I can reach out to the Division of Transit and Rail and see what kind of new services, routes. Are you referring to a regular type of bus stang route, or are you talking about just the special event ones you mentioned?
Actually, it would be two things. One would be like special events for, specific games. You think about like the Broncos games. There's a lot of people that drive up that way from here, and it would help reduce a lot just by
Yeah.
having people, carpool or take the bus. And then the other route would be up to Summit County for skiing.
Right. Yeah. So if you've heard any of the presentations on the skiing, the ski bus, ski stang, snow stang, they call it. Those have required some commitment from the resorts themselves. So the services, it wasn't just up to CDOT to decide which resorts to go to. Each of those resorts provided some funding to the program to make it possible, not the whole they don't pay for the entire service, obviously. So part of it comes down to that. And again, I don't know what kind of conversations have been had with other agencies, and especially, getting them to the Pikes Peak region. So again, I'll follow up with the DTR and see if I can channel to all of you a little bit about the different types of services possibly being considered in the future.
This is Laura Cruz, Mobility Coordinator for PPACG. Just wanted to make a comment on her comment. Just to let you know, we're actually in the middle of a tri-county study, and I think we have talked about that a couple of times in the CAC. But we have put together a transit focus group for the tri-county study, and it is to talk specifically about those types of things. So more to come on that. Obviously, our goal with the tri-county study is to identify projects that we can source funds for in the future. But that is something that is in communication, not just from a recreational side, but also from just general services to that region and that corridor. So I have taken that note down as a suggestion. But one thing else is bus stang does provide a Broncos bus from Colorado Springs up to Denver. So information about that's on their website. So I just wanted to let you know that is happening.
Well, thank you. Any other questions for Michael before we move on? So next up, John, you're already been sucked into the conversation, but you're next on the agenda for the CDOT 10-year plan. So that's action item 5A.
Uh,
Go ahead.
Sorry, I thought I was stepping on you. Thank you, Madam Chair. We've got two parts to this. We've got Shane Ferguson on the call to help with the kind of the roadway list, but there's two lists in your packet. So real quickly, let me kind of address the whole overall concept. So what happens is, and this had started a few years back, that given the different uncertainty of funding back then, we had to develop these lists of, if money were to fall from the sky, sort of thing, what are our project priorities? That soon then sort of morphed into a, well, as long as we've got this list, let's make it a 10-year list, and that will then feed into the state long-range plan. Now, the state long-range plan in of itself isn't required to have projects, a project listing with it. So while the state 10-year plan talks about policies and funding opportunities, it's the actual 10-year list where projects are drawn from. And previously, the last time we did this exercise, we had 4 priorities. And when we get down to the sort of thing from the roadway portion, a lot of those have been addressed, and it was time to sort of redo it anyway. But now, given additional funding with SB 260, as well as probably the funding opportunities we'll see from the Infrastructure Improvement Jobs Act, or IIJA, or as I like to lovingly call it, the Ouija Board Act, there's going to be more funding available for projects, and this lets us have the opportunity to sort of get them lined up and ready to go. So we'll talk about that list in a second. The other list is a list of transit opportunities. And Jess, if you're driving the agenda, if you can scroll down a little bit to the transit list, which I think is listed second, because I don't see Jeff on the line. So we'll just handle this real quick. So this is a listing of the transit related projects that are our priority. So as funding opportunities come available, we'll sort of start at the top of the list and we'll go down. Now, there's two things. First, it's not a done deal that everything on the list gets done, because while this is a list of priorities, it is not actually putting these projects into our Transportation Improvement Program, or TIP. So projects to be funded need to be in the TIP, and to be in the TIP, they have to be consistent with our long-range plan. So just keep that in mind. This is a list of priorities, but if these things move from a priority list to an actually we're going to do it list, you all, the CAC, as well as the TAC, as well as our board of directors, would all have a quote unquote second bite at the apple to then actually approve the project onto those lists. So just keep that in mind. By voting for this today, we're not actually committing to doing any of this. The other thing about these lists is sometimes projects are listed as a priority because we want to do them, but they're not actually ready to go. Or we checked in the seat cushions of the couch, and we have $5 million, and our next priority is a $10 million project. So sometimes we have to leapfrog over projects to do the projects that we actually have funding for. And while it's nice to say, well, we'll just save up for that bigger project, the strings attached to a lot of these funds don't allow us to roll the monies forward. So there are use it or lose it situations where we have to move forward. So the next thing, then we'll sort of take everything all at once. So if we can move back up to the roadway list. And then here's the roadway list. I think we still have the first 4 projects on the list from before. Again, we have a great CDOT region here that gets projects done, and we're so appreciative for Rich and Shane and Rob and Wendy we're actually seeing projects under construction. So the first four projects were the first four projects on the previous list. They're actually either under construction or they're fully funded and we'll see them soon. So the things that we're going to be talking about now is our priorities moving forward, which is sort of that list in the white. As you see that blue line, that's the sort of guesstimate of maybe where the funding constraint line will be. Everything above the line we have money for, everything below we don't. That's just a guesstimate. We have not actually received our fiscal constraint numbers, so that little blue bar could move up or down. So with that, I want to just finish with one other thing. Usually we bring you things sort of, 2 meetings in a row. This is information, and then this is the actual adoption. The TAC last meeting said, yeah, we're good with this list. We vote to move this forward and move on. So I think when we take it to the board of directors, this will probably be hopefully an action item. So if you're good with that, we would love to see it be recommended for adoption. Although if there are serious questions, we certainly can hit the pause button and come back and take another month and then consider this like information, and then next month would be action. But our druthers, I woke up this morning, wanted to use the word druthers, but our druthers would be to go ahead and get this adopted now if you guys are comfortable with that. But with that, I've got Shane on the line. Shane, do you want to add anything I might have missed, or do you just want to field questions about the projects?
Yeah, I think you've done a great job explaining. I'll just kind of do a real quick run over these projects, at least in the white. Like you said, the ones in the yellow, the very top of the list, the top 3 are under construction, and that Fillmore to Garden of the Gods is in design, and we're going to add probably in September of this year to let that one go into construction as well. The next yellow sector, or the white sections down, we're starting the design for the airport and Powers interchange. We have monies planned here in the very near future for design for the US 24 East widening. That's going to be to a 4-lane section from Woodman Road to Garrett Road. Colorado 67, just north of Woodland Park, that is a reconstruction of some drainage and added turn lanes, as well as some pavement improvements along that piece of that's about a 1.5 mile section there, just north of 24. And then US 24 over Ridge Road, that's an overpass. That's kind of the first project that we'll dive into with the US 24 environmental assessment document. Followed by, we want to continue just the improvements we're making on I-25. What we've got going on right now is the MAMSIP, which is all south of South Academy, but we have a section between Circle and South Academy that we'd like to address next. Ultimately, that's to be a 3-lane section, but we've got a few pieces that we want to address first, and it's really replacing that bridge at 85 and the railroad bridge that goes into Fort Carson in that area, plus some additional safety improvements. And then followed by on Powers, we want to keep marching down Powers corridor per the EA and continue to make that a freeway condition. So starting in design for the Milton E. Proby Parkway and Powers corridor interchange location. Followed by US 24 East, where we stopped at Garrett Road with that previous project number 6. We would continue on to Stapleton, 4-laning that section. And then down the list again, just the idea and the theme of, we want to continue to march down Powers Boulevard. Another interchange down the line would be double interchange intersection. And then on 24 to final this list out, we've put on 24 and 31st Street. And currently it's at grade intersection in the EA, but we want to take a look at that and see if it's something that we really want to do an interchange at. So be opening up that EA and doing some investigation and public involvement and read some dialogue at that 31st Street intersection. So that's a brief summary of the projects. Thank you, John, for that dialogue on how we got to this point. I am willing and open for questions you guys may have for me.
Thanks, Shane. And one other quick thing, the very first project in the gray there, I think we're still working on the language.
I sent that to you guys. So this is not the updated one. I know I did send that out. Yeah.
Yeah, no, I was about to, I was not throw you under the bus. Maybe gonna give you a little nudge towards the train rails, but no, it's on us. But I'm just saying, I did notice that this did not have updated language on that very first project.
Yeah, thank you. Sorry, John. I jumped the gun on this.
Which I think there's been a lot of discussion about the last time we did some of these HOV lanes and they ended up being toll lanes. So in full transparency, it's been suggested that anything that gets listed like this, we list it phase 1 I-25 HOV lanes, open parentheses, end parentheses, or bracket, no bracket, possible toll lane configuration and bracket. And that's just, again, to make sure that everybody knows up front that that is a possible scenario for project moving forward. So just want to make sure everybody was aware of that. And we will change that language by the time it gets to the board, because if it doesn't, they will have no mercy on me.
Roy Rosenthal, I have a question on the opening up for public comment on things like the 31st Street interchange. What would be the time frame on when the public would get involved?
Yeah, so that one is so far down the list. You know, I imagine it's going to be towards the end of the 10 years that we would start that process.
Okay.
Yeah, and so
it really needs it.
Yeah, I mean, we have so many needs in this area, as well as, you know, along Powers, 25, et cetera. But yeah, for that one in particular, I would guess it's going to be towards the end of that 10-year period of time if we get a chance to tackle it.
Yeah, typically, Roy, what happens is when they're going through the design, there will be outreach, and then the public will be sort of looked to sort of give their input. For example, right now, CDOT's doing a wonderful series of public outreach along 115. So they'll have meetings and get input through that design process. Then typically after they've gotten the project designed and it's sort of ready to go and it goes out to bid, then there will be actual construction meetings where then the construction contractor will come out and say, hey, we're going to close this road, we're going to close that road. You're going to have limited access at this time, all sorts of things like that. So there's really sort of two rounds that will happen. One will be years before the project actually happens. And then one will be buckle your seatbelts, the dirt's about to fly. So,
okay. Thank you.
Yep. Any other questions? Let's
this is Gary.
Stump Shane.
Yeah, we have one more question here. Go ahead, Gary.
Yeah, my question is, why is the Milton Proby Parkway interchange broken into two phases, and why is that so that looks like a total of $150 million. What's so unique about that interchange?
Yeah, that's a great question. So the way it was projected out was the ultimate condition for that will actually be flyover ramps similar to the Milton Proby, and I believe that's Academy. We'll have a couple of overpass flyover ramp configuration, but that is the ultimate condition when the traffic necessitates that type of condition. This first is really just if you'll think through just I don't want to call it a normal interchange, but a great separated bridge with ramps and not throwaway. I'll say that it would be designed in a way that where you can continue to utilize the ramps in building the ultimate flyover condition. And so that interchange is for the foreseeable or the long-term condition is looking at a major flyover directional interchange based off of just development in that area, the airport development in that area, and continued growth.
Thank you.
Thank you. Any more questions before we go to get a motion here? So we need a motion to recommend approval of the PPACG CDOT 10-year plan.
Patty Benjer, I just typed in one question to the chat to Danelle. I just wanted to confirm that the only difference between the file that she uploaded and the one we're looking at today, the only difference is the language on the toll roads, possible tolls.
There are actually 3 minor changes to that list. The TAC made The toll language, there's also, there's a project added to the end that is, let me get it open, I'm sorry.
Yeah, it's the US 24 and 21st intersection was omitted from that list
Yes.
on accident and is added to the bottom of the gray section.
Can we let Danelle share her screen so everyone can see it? I was not aware we didn't have the right one. I mean, if we're asking people to vote on it, we should probably show it to them. I mean, I am a pretty trustworthy guy, but I would see why you'd want to actually see it. So
Yes. Can you see my screen?
Yes.
yeah, can we make it a little bigger, Danelle?
Sure.
Remember, I got the old guy eyes. One more. Perfect, thank you. All right,
So
go ahead.
yes, we did add that, that last project down here at the bottom. And then there were the HOV possible toll-free lanes right here.
And you said there was 3, what's the third one?
I think it was just those were the main comments, if I recall correctly.
Okay.
Yes.
Okay, any more questions? Thank you for the updated information. That helps a lot. So could I have a motion?
Patty Benger, I recommend approval of the PPACG CDOT 10-year plan with the inclusion of the additional language from the TAC meeting.
Thank you.
I'll second Terry Hayes.
Thank you. Any additional discussion? All those in favor?
Aye.
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 Any opposed? I would say the motion carries. So John, you're up again. Next item 5B, the safety target setting data.
Thanks. I will kind of kick it off, but we have actually 2 experts with us. We've got Darius and David from CDOT to help out with this. I'll give you sort of the background. For those of you who have been on the CAC for a while, you might remember that about once a year at this time, let me start that again, maybe this time in English. This time every year we would come and we'd say, hey, the federal regulations say we need to make a decision on our performance measures regarding safety, and we have to take the option of either adopting and supporting the CDOT targets or setting our own. And every year since I've been here, I've said, look, it's all risk and no reward for setting your own targets. We're always better off going with CDOT. Now, recently, this new funding bill at the feds, the IIJA, they actually have funding in there for some new safety programs. So that might change for next year. But for this year, my recommendation is still that we are far better off taking the CDOT goals and supporting them rather than going it alone and doing our own thing. I know there are some folks that get sort of wrapped up in the language and say, well, how come we have a target of 3 deaths? We should never target 3 deaths. It should be 0. And I completely agree. There's a difference between what you say to folks versus what you fill out on a federal form and that the feds hold you accountable to. So while the language might be difficult for some, again, it's not saying that we're shooting for 3 people like that I'll go out and make sure that we hit our target. It's that is the number that we're going to submit to the feds based on, again, supporting CDOT. So that's what we're doing here in a nutshell. Again, the federal performance measures set out safety goals and targets. CDOT has been kind enough to give us our existing numbers, I believe, as well as the targets for 2022. So you can see what they're talking about. But that's where we're going. Again, this is another one where, because of the federal deadlines, we need to sort of move forward with a motion to adopt one way or the other to move this on, because we are required to meet a deadline. So in a perfect world, we would have had everything sort of sorted out earlier and brought it to you once for information and then again for action. But unfortunately, that's just not the way things worked out this year. So we are looking for a motion to approve. And again, one way or another, we have to provide a letter to CDOT to be in compliance with federal regulations after the next Board of Directors meeting. And really, and again, Darius and David, correct me if I'm wrong, our only two options are we either are going to set our own targets and go it alone, or we're going to, again, accept the CDOT targets and support those over time. So with that, Darius, do you want to add some stuff, and David, and then we'll open it to committee questions?
Yeah, no, I'll go quickly. I think you covered it, John, and those are our two options as far as what MPOs can do in regards to the performance metrics, not only with safety, but for all the other areas as well, which we're not talking about those today. Only safety is required annual review and annual setting of targets, which you see on here. And I think Dave can go into more specifically on how those targets were set. The deadline is February 27th for all the MPOs to either support the state targets or set their own. Then afterwards, evaluation for the state as a whole is conducted about 1 year after the close of the reporting years. For 2022, it will happen around 2024. So we will probably see any type of evaluation for the federal government for 2020 later on this year. So that's all I'm going to add. Dave, I'll turn it over to you for any specifics regarding the safety targets and data.
Okay, thanks, Darius. Yeah, and I'm David Swanka. I'm with the CDOT headquarters Traffic and Safety Traffic and Safety Engineering Group, and my group manages the crash data and assists with the setting of the performance measures every year. And this year was especially challenging in setting the targets, just because we are seeing an upward trend. And I should say 2020 was an interesting year due to COVID, where you saw a lot less travel, a lot less overall crashes, but still slightly more fatalities than the year before. And we didn't know at the time, setting the measures earlier in 2021, but we didn't know it was going to get much worse to the point where we're getting close to reaching an all-time high for fatalities for Colorado. 2002 is the high mark, but the number of fatalities that we've had in 2021 is the highest since that time. So we're approaching, well, the year is over, but we're still getting the information. But right now we have 688 fatalities for Colorado. And we're expecting that number to get close to, if not over 700 when all the data is received by us, and we've accounted for everything, which still takes a couple months after the end of the year. But with that in mind, the way we set the targets was just because of that uncertainty of the 2020 effect. Really, the thinking was, well, is 2020 an outlier? Should we really consider that data? And because we do a trend analysis, and just because there was that shift in 2020, we weren't sure if that was a temporary thing or if that was just an outlier. So the decision was to kind of reset back to 2019. And what you're seeing in the 22 safety targets is what the yearly total was for 2019 for Colorado, and the number of fatalities and the number of serious injuries, and also the rates. And granted, the safety targets here are a 5-year average, not a 1-year target. But that was the idea, and that was sort of what was agreed upon to set for 2022. It's, in hindsight, it's it's very aspirational, and we probably won't hit it if things continue the way they are or are close to the way they are. But that's what was the thinking at the time. And it's like I said, predicting what's going to happen in the next year or two is very interesting these days. But that was sort of our basis of our decision back then. If you have any questions about anything else, let me know.
Thanks, David. Yep. Any questions from the CAC?
Yes, David, I think you're probably the right person to answer this question. So it sounds like, our options are create our own regional targets or go with these statewide targets. If each region has the power to set their own targets, how does the state control that when we're talking about statewide numbers that we're setting targets for as a whole, and then a region might be an outlier that has their own targets that may or may not match? What happens when that occurs? And hopefully,
So we, like David, to put a finer point on that, DRCOG, right, selects their own. So what do you do for DRCOG, since they do select their own targets?
Well, I think that's done independently. I mean, they submit their numbers. I don't know, Darius, are you involved in that process, or because that doesn't come through us necessarily, does it?
Yeah, no, they submit their own numbers, and they very similar, a board of resolution that has their own numbers. Honestly, the effects for the MPOs aren't as the consequences for not meeting the targets aren't, the MPOs don't have any of those consequences. Consequences come to the state. If we do not meet if we go lower than 4 out of the 5 targets, if we don't meet those or are worse than our baseline, so worse than what was the year that that was reported for them, the baseline data, then they call that, then there's 2 things. One, we have to report in the HSIP plan, which David does, what we're going to do to improve, and we have to obligate 100% of our HSIP dollars to safety projects. The obligation piece isn't a big deal because we already use 100% of our HSIP dollars for safety projects. It's just you have to obligate it all in the same year. That's kind of the tricky part of it. As far as what the consequences for the MPOs if they don't meet their targets, technically what you're supposed to do with the targets is use this to help with setting your tip, and use this as how does your project affect these targets. So kind of making those type of connections on there. But as from the federal rule, there is nothing that will happen to the MPO or stuff that MPOs need to do if you don't meet targets, if you set them their own. So if there's a region that contributes to, like, has abnormally high and everybody else is doing well, then the state will have to take into account what's going on there, and maybe there might be some mitigation efforts within the HSIP program, and of course we would document some of that stuff in the HSIP report. So hopefully that answers your question.
So Darius, for example, DRCOG, do you put their data into your calculations, or because they've opted out, you take their calculations out, and that's separate, or you still have to account for it no matter what?
We still have to account for it. Correct me if I'm wrong, Dave, the numbers are still statewide, whether DRCOG has their own targets or not. We do provide their targets to FHWA, so they do know about them. But it's still a statewide number. We can't take out a certain region because they set their own targets.
All right, gotcha. So Patty, did that answer the question?
It did, and I'm sorry, I have one more question. So the numbers that you're talking here, it's not just on CDOT responsible roadways, it's any state transportation accident, no matter who is responsible for the road.
Yeah, any public roadway.
Okay,
Correct.
thanks.
Any other questions? Oh, go ahead.
I was just going to make a motion, sorry.
Oh, wonderful. Thank you. Go ahead.
Patty Benger, I recommend approval of the PPACG supporting state safety targets for calendar year 2022.
Thank you. Do I have a second?
John DeVoe, I'll second it.
Thank you. Any further discussion? All those in favor?
Aye.
All right.
Aye.
Opposed? I'd say the motion carried.
Yep, thanks, everybody. And a special thank you to Darius and David for hopping on the call. We appreciate your support.
Yes, thank you. Interesting.
You're welcome.
So on the agenda, 5C has been postponed till next time, I wrote. Next up is any member discussion? Any special items for the next CAC meeting? Oh, quiet group. Jessica, you want to talk about the meeting and event schedule? Anything's coming up that we should make note of?
Just the first 4-part Medicare series begins next Thursday. And if you all remember from last year, we took our Medicare 101 classes that used to be a 1-2-hour class every month or so that frequently ran up to 3 hours. And we actually broke that down into a 4-part series. And so our first one of the year will be first Thursday in February. We're also going to be beginning our Medicare Lunch and Learns, which are special topics that really dig into the kind of things that folks have told us they need to know. So that meeting and event schedule is there, but you can also always get these on our website. So there's lots of exciting things happening and going on.
Well, thank you. And I don't think we need to do a motion to adjourn. So unless there's any, speak now or forever hold your peace, and then we'll adjourn the meeting. I see smiles. I think the meeting is adjourned.
Thank you, Miley.